Hello, my name is Madison Taylor. I am a first-year medical student at the OSU CHS campus in Tulsa, and I will be presenting over the socio-demographic analysis of pediatric emergency department visits using the 2019 NHAMCS dataset. Trends in pediatric emergency department visits from 1997 through 2007 are stable but substantial in number. Reasons for these visits include specific disease-related causes, as well as child maltreatment, unintentional injuries, and self-harm. Frequent ED usage is often associated with individuals who experience poorer social determinants of health. Knowing this, our primary objective was to identify and describe the population characteristics among all pediatric emergency department visits using the data from NHAMCS. Then we want to evaluate potential differences among these demographic factors in triage level, wait times, and intentional versus unintentional traumas and poisonings. In order to do so, we conducted a cross-sectional analysis using the 2019 NHAMCS data to determine the prevalence of pediatric emergency department visits in the United States. Our sample consisted of 337 hospitals and 16,207 individual ED visits. This study excluded individuals over the age of 18 and those pronounced dead on arrival at the hospital. We used chi-squared test logistic regression to assess wait times, triage level, and self-inflicted injuries or poisonings. Our results found that the majority of children going to emergency departments were white, non-Hispanic, male, between the ages of 0 and 2 years, and were on Medicaid or CHIP. Of these children with comorbidities, the most commonly reported conditions were asthma, depression, and obesity. Indigenous children had significantly longer ED wait times compared to white children, and 44.5% of visits among non-metropolitan areas were for trauma, poisoning, and overdose, whereas only 30.8% within metropolitan areas were for those reasons. The 15 to 17-year-old age group had the shortest ED wait times compared to any other age group. Additionally, you can see the distribution by age, sex, ethno-racial grouping, and metropolitan status of the NHAMCS dataset. In conclusion, our study represents a pediatric ED population primarily composed of children under 7 years of age within MSA regions and consistent with the National Ethno-Racial Census. More than 12% of pediatric ED patients had one or more comorbidities, and nearly 3 in 5 visits were covered through Medicaid or CHIP. Notable disparities from our study were longer wait times among Indigenous children, higher prevalence of traumas and poisoning in non-MSA settings, and differential rates of triage level by ethno-racial group. To improve overall access and decrease non-emergent ED usage, we recommend that healthcare workers implement extended hours, expanded language services, and the use of telehealth to better accommodate patients in the ED.